Carpal tunnel syndrome occurs when the median nerve, which runs from the forearm into the hand, becomes compressed. Symptoms include numbness, tingling, and pain in the hand and wrist. It's important to seek treatment for carpal tunnel syndrome early, as untreated nerve compression can lead to permanent damage and loss of hand function. If conservative treatments like splinting, physical therapy, or injections fail, carpal tunnel surgery can relieve the pressure by creating more space for the median nerve inside the carpal tunnel. Both open and endoscopic methods for release divide the transverse carpal ligament. Surgery may quickly improve symptoms, but full recovery may take up to a year.